Hi, good morning Aston. My name is Nicole Kidman. I'm your invigilator for the OET speaking session on the 27th of May 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Aston Harley.
And what is your candidate number, please?
My candidate number is 236871000.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Are you a self-motivator as a nurse?
Absolutely. I can always find something productive that needs doing. I am very motivated to do a good job at what I take on, and I like to stay busy. I am a self-motivator, and I take great pride in my job as a nurse.
Would you describe yourself as organized, as in the nursing field?
Absolutely. I like to have a checklist and make sure that each item gets the attention it needs. Sometimes a little too much so. I make sure that everything is neat and in order. I am a very organized and thorough person, which I think contributes to my success as a nurse. I use several online and desktop tools to stay organized. I like to carefully plan my daily, weekly and long-term work project. That helps me stay organized.
What do you find most rewarding about being a nurse?
The most rewarding thing for me as a nurse is seeing the joy when a family first holds their baby. Mainly, interacting with the patients and their families is what I find most rewarding. Next, I find helping patients through recovery after surgery, which is often one of their greatest challenges, to be most rewarding.
What do you feel when you contribute to your patients as a practical nurse?
When I offer my patients the very best care and advocacy I can, I believe that I offer my patients comfort and confidence that they are being well cared for. I feel that my patients know that I am there to provide comfort and understanding, that I will listen to their concerns, and that I will act as their advocate if necessary.
How would you handle a patient who constantly complains about pain as a practical nurse?
I would confer with the attending doctor to make sure that the patient's pain was being managed in the most effective way. I would reassure the patient that everything possible was being done to alleviate their discomfort. I would also listen sympathetically to their complaint, reassure them that their concerns were being heard, and that we were doing everything possible to help them.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Aston Harley, one of the nurses working in the community health center. How may I help you today?
Good morning, nurse. I'm here to get some advice on my father's health and care.
Definitely, we can help you. By the way, how may I address you?
My name is Nicole Kidman, and you can call me Nicole.
All right, Nicole, tell me what exactly is bothering you about your father's condition.
Nurse, my father is an 80-year-old man who needs care and attention, but my father decided to live alone in a home which is quite far away from where I live. So, I would really love to know about the supportive services that you provide for the elderly.
We are glad to help you, Father Nicole, but before that, I would like to know more details about your father. For that, shall I ask you a few questions?
Yes, of course. You may please.
All right, could you please brief me about your father's general background?
Sure, nurse. Generally, he is well and healthy. He is not under any medication, and possesses no illnesses. Talking about his habits, he is a non-drinker and non-smoker. However, I have recently noticed some signs of deterioration in my father's health. I am really worried, and feeling so helpless.
So, basically your father is healthy.
Yes, nurse, but the changes in him make me more concerned.
Be relaxed, Nicole. Being a daughter, I can understand the situation you are going through. Don't worry, we are here to provide help and assistance for the community. I can assure you that we can provide the necessary care to your father, based on his condition.
Thank you for your kind words, nurse.
No mention, Nicole. Well, to my greater understanding, Nicole, please explain to me what exactly your concern is about your father's condition?
Nurse, I have been noticing his recent activities. It shows some changes in his daily activities. For example, I noticed that he is unsteady in walking. Also, I can find his physical strength has reduced considerably, which is evident from his daily routines. Earlier, he was a man with his own disciplines, he was really neat and tidy, but now, when I visited him, the house was untidy, and his appearance was horrible.
Please be easy, Nicole. I can understand the situation you are going through. Let me explain what I have understood from your words.
All right, nurse.
From your observations, what I can tell you is that these are some normal signs of aging. When people grow older, they behave like a kid and feel lazy to do things that they were doing regularly. In this situation, the best and appropriate solution will be to provide assistance to them at the right time. And now, you are at the right place, so there is nothing to worry, Nicole.
I feel relaxed from your words, but I would like to know if you can provide assistance to my father at his home itself?
Yes, Nicole, we have community nursing services that could assist your father at home itself.
Can you please explain to me about the kind of assistance that my father can receive?
It is my pleasure. Your father can get help for his activities of daily living, such as self-care. Along with that, he may also enjoy the benefit of getting Meals on Wheels services, hence cooking will not be a burden for him anymore.
That sounds perfect, nurse.
Other than these, he can also get once in a week home care, to clean the house and surroundings.
That's really appreciable, nurse.
Great. Thank you. And do you have any other concerns?
Yes, nurse. And, if you don't mind, can you please directly visit my father, and speak to him once, in order to assess his needs?
Why not, Nicole? Definitely, I can visit him. Well, not making any delays, I can book an appointment for tomorrow at 9 a.m. in your father's home, to see him in person, and identify his needs. Is that okay for you?
That's lovely, nurse. I will try my best to be there tomorrow at 9 a.m.
Okay. That's great. Then Nicole, see you tomorrow.
Thank you, nurse.
No worries, Nicole. It's my duty, and I thank you for visiting us and showing the trust in us.
That is the end of your OIT speaking role play. All the best.
Thank you.
Thank you for watching. Please, Like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.